Welcome to The Explainer. Okay, let's talk about something that trips up so many people. What is the actual difference between Medicare and Medicaid? I know, they sound almost identical, but they are worlds apart.
Hey, if you've ever gotten these two mixed up, you are definitely not alone. But stick with me, because by the end of this, you're going to be a pro. Let's dive in.
So here's our game plan. We'll start with the basics, then we'll decode that Medicare alphabet soup. After that, we'll look at Medicaid as a safety net, see how you can qualify for both, and wrap it all up with costs and the main takeaways.
All right, let's jump right in. Seriously, if you only remember one thing today, this is it. Okay, so here it is, the big difference. Medicare? Think age or disability. It's mainly for people 65 and up or those with certain disabilities, and your income doesn't really matter. Now, Medicaid, that's all about income. It's for people with limited income, whatever their age. A little trick I like is Medicare cares for the elderly and disabled, and Medicaid aids folks with low income. Simple, right?
So, now that we've got that main distinction down, let's zoom in on Medicare. Because it's not just one thing, right? It's a whole bunch of different parts, A, B, C, D. People call it the alphabet soup for a reason. Let's figure out what's in the bowl.
Basically, you've got four main pieces: Part A, Part B, Part C, and Part D. We're going to go through them one by one so you'll know exactly what's what.
First up, Part A. Think of this as your hospital insurance. So if you're admitted to the hospital, this is what kicks in. And for most people who've paid Medicare taxes for about 10 years or so, you don't pay a monthly premium for it, which is great. But, there are still costs like deductibles you'll have to cover. Okay, next we have Part B. This is your medical insurance. We're talking about all the day-to-day stuff: doctor visits, lab tests, x-rays, even flu shots. Now, this part is technically optional, and you do pay a monthly premium for it. But, and this is a big but, if you don't sign up when you're supposed to, you could face penalties down the road. So it's pretty crucial for most people.
Now, Part C is a bit of a different animal. You'll hear it called Medicare Advantage. Basically, these are plans from private insurance companies that bundle everything together for you. They take Part A and Part B and usually toss in prescription drug coverage too. A lot of them even offer extras like vision and dental. The catch? You generally have to use doctors and hospitals that are in their network.
And last but not least in our alphabet soup is Part D. D is for drugs. Simple as that. This is your prescription medication coverage. So if you have what's called Original Medicare, just Parts A and B, and you want your prescriptions covered, you have to sign up for a separate Part D plan. All right, so we've cracked the code on Medicare. Now let's totally switch gears and talk about Medicaid. Its whole purpose is different. It's really built to be a vital safety net for people. And here's another huge difference in how they're set up. Medicare is a federal program, right? The same rules apply everywhere. But Medicaid, it's actually a joint program between the federal government and each individual state. And that partnership really changes how it all works. So because the states have a big say, the rules for who can get Medicaid can be totally different from one state to the next. It really depends on where you live. The one thing that's the same everywhere, though, is that it's all about your income level. Now, even though states get to make some of their own rules, the federal government steps in and says, hey, every Medicaid program has to cover these essential things. We're talking about stuff like hospital care, doctor's appointments, the basics. This makes sure there's a standard level of care no matter what state you're in. Okay, this is a really important point about Medicaid that a lot of people don't know. It is the #1 payer for long-term care, like nursing homes, in the entire country. That is a massive expense that Medicare just doesn't cover. For so many families, Medicaid is what stands between them and financial ruin when a loved one needs that kind of care. All right, so we've established Medicare for age, Medicaid for income. But what if someone fits into both categories? What happens then? Can you have both? The answer is absolutely yes. And when someone qualifies for both programs, there's a special term for it. They're called dually eligible. So how does this usually happen? Well, a common example is someone with a low income who's been on Medicaid for a while. Then they turn 65, and boom, they also qualify for Medicare. When that happens, the two programs actually coordinate to cover their medical bills. Okay, let's get down to brass tacks and talk about the money, the costs, and then we'll do a quick final review to make sure everything we've talked about is crystal clear. Just to give you a real-world example of what these costs look like, let's take Medicare Part B, that medical insurance part. The standard premium for that is expected to be around $206 a month in 2026, and that's a direct out-of-pocket cost most people on Medicare will pay every single month. And it's not just that monthly premium either. As you can see here, with Original Medicare, you've also got deductibles you have to meet for hospital stays and for your medical care. And if you go with one of those private Part C or Part D plans, well, the costs can be all over the map. It just depends on the plan you pick.
Okay, let's boil it all down one last time. Medicare. It's federal. It's for people 65 and up or with a disability. And you're going to have some costs. Medicaid. It's a federal and state partnership. It's for people with limited income, and for them, there's very little, if any, cost. That's it. That's the big takeaway.
So now you know the difference. The next time you hear someone say Medicare or Medicaid, it won't just be a blur of similar-sounding names. You'll understand what they really are. Two completely different systems with two different promises. One is a promise of health care as we age, and the other is a promise of a safety net when we need it most. And knowing that, well, that's the first step to making sure you're on the right path for your healthcare future.